Question number 1. A client with a history of coronary artery disease is admitted with chest pain. The nurse notes ST segment elevation in leads 2, 3 and augmented vector foot on the ECG. Which intervention should the nurse prioritize? Options. Option A. Administering nitroglycerin sublingually. B. Preparing the client for immediate percutaneous coronary intervention. And C. Administering morphine sulfate for pain. And D. Monitoring the client cardiac enzymes. So here the right answer is option B. Preparing the client for immediate percutaneous coronary intervention. So XT segment elevation in leads 2, 3 and augmented vector foot indicates an inferior myocardial infarction. So immediate percutaneous coronary intervention is the priority intervention to restore blood flow to the affected coronary artery and minimize myocardial damage. Nitroglycerin and morphine are important for pain relief and reducing the cardiac workload, but restoring perfusion is the highest priority. Question number 2. A 4-year-old child is brought to the clinic with symptoms of frequent urination, increased thirst and unexplained weight loss. The nurse should prepare the client for test to confirm which diagnosis. Options. Option A. Diabetes mellitus type 1. B. Diabetes insipidus. C. Hyperthyroidism. And D. Cushing syndrome. So here the right answer is option A. Diabetes mellitus type 1. So the symptoms of frequent urination, increased thirst and unexplained weight loss are the classic signs of diabetes mellitus. Question number 3. A 60-year-old woman presents with postmenopausal bleeding. Which of the following is the most appropriate initial test? Options. Option A. Pap smear. B. Transvaginal ultrasound. C. MRI. And D. CT scan. So here the correct answer is option B. Transvaginal ultrasound. Postmenopausal bleeding is concerning for endometrial pathology. So a transvaginal ultrasound is the best initial test to evaluate the endometrium. Question number 4. A nurse is teaching a patient with newly diagnosed type 2 diabetes about foot care. Which of the following statement indicates the patient needs further teaching? Options. Option A. I will inspect my feet daily for any sores or blisters. B. I should soak my feet in hot water every day. C. I will wear well-fitting shoes to protect my feet. And D. I should avoid walking barefoot even at home. So here the right answer is option B. I should soak my feet in hot water every day. Soaking feet in hot water can cause burns or skin breakdown. Warm water and daily inspection are recommended for the patient with diabetic foot care. Question number 5. A pediatric patient with a history of asthma is experiencing respiratory distress. Which of the following is a late sign of respiratory failure in this patient? Options. Option A. Use of accessory muscles. B. Trachypnea. C. Cyanosis. And D. Wheezing. So here the right answer is option C. Cyanosis. So cyanosis is a late sign of hypoxia and impending respiratory failure, indicating severe oxygen deprivation in the body tissues. Question number 6. A 28-year-old woman presents with a thick white vaginal discharge and itching. Which of the following is the most likely diagnosis? Options. Option A. Bacterial vaginosis. B. Trichomoniasis. C. Candidiasis. And D. Gonorrhea. So here the right answer is option C. Candidiasis. So candidiasis or yeast infection that is typically present with thick white vaginal discharge and itching is present. Bacterial vaginosis is present with a thin grey discharge and a fishy odor, while trichomoniasis and gonorrhea usually present with different symptoms. Question number 7. A client with chronic kidney disease is prescribed phosphate binder. Which dietary instructions should the nurse provide? Options. Option A. Increase consumption of dairy products. B. Limit intake of high phosphorus foods. C. Increase intake of citrus fruits. And D. Avoid foods high in potassium. So here the right answer is option B. Limit intake of high phosphorus foods. So phosphate binders are prescribed to reduce serum phosphate levels in clients with chronic kidney disease, instructing the client to limit intake of high phosphorus foods. So it helps to prevent hyperphosphatemia and its complications. Question number 8. A nurse is caring for a child with severe dehydration. Which of the following findings would the nurse expect? Options. Option A. Hypertension. B. Tachycardia. C. Bounding pulse. And D. Increased urinary output. So here the right answer is option B. Tachycardia. So severe dehydration often leads to tachycardia, hypertension and weak pulse. It is due to decreased intravascular volume. Question number 9. A morbidly obese 32-year-old woman presents for contraceptive counseling. Which of the following is not absolute contraindication to use of oral contraceptives? Options. Option A. History of pulmonary embolism. B. Hepatitis C carrier. C. 1 pack per day smoker. And D. Estrogen receptor positive breast cancer. So here the right answer is option C. 1 pack per day smoker. So absolute contraindication to initiation of oral contraceptives include thromboembolic disease, chronic liver disease, undiagnosed uterine bleeding, and pregnancy and estrogen dependent neoplasia. So related contraindications are smoking in women aged more than 35 years, migraine headaches, cardiac disease and diabetic complications. Question number 10. Which assessment finding indicates a potential complication of intravenous therapy? Options. Option A. Warmth and erythema at the insertion site. B. Absence of blood return when flushing the catheter. C. Formation of small bubbles in the IV tubing. And D. Palpable thrill along the insertion site. So here the right answer is option B. Absence of blood return when flushing the catheter. So the absence of blood return when flushing the IV catheter suggests catheter occlusion, so which can prevent medication delivery and increase the risk of complications such as thrombosis or infection. Question number 11. A nurse violates the civil rights of an individual may be committing what? Options. Option A. Tort. B. Negligence. C. Malpractice. D. An unintentional tort. So here the right answer is option A. Tort. So violating civil rights constitutes a tort, which is civil wrong causing harm to someone. So negligence and malpractice refer to professional misconduct. An unintentional tort involves causing harm without any intention. Question number 12. A nurse is caring for a patient with no colostomy. What is the most important aspect of patient education before discharge? Options. Option A. How to identify signs of infection. B. Dietary changes required post-surgery. C. How to care for the stoma and change the colostomy bag. D. Importance of regular follow-up appointments. So here the right answer is option C. How to care for the stoma and change the colostomy bag. So while all the other options are important, the priority in patient education for someone with a new colostomy is teaching them how to care for the stoma and change the colostomy bag. So this ensures the patient can manage their colostomy at home, so which is crucial for their independence and prevent complications. So identifying the signs of infection, dietary changes and follow-up appointments are also important but are secondary. Question number 13. You are assigned to educate the nursing assistants regarding caring for the older adult. So it is important that the assistant understand that which of the following situations portrays ageism. Options: Option A, accepting differences among older adults. B, advising older adults to go for aggressive treatments. C, allowing older adults to make a decision. And D, informing the older adult for their rights. So here the right answer is option B, advising older adults to go for aggressive treatments. So ageism refers to prejudice or discrimination against individuals based on their age, particularly against older adults. So advising older adults to go for aggressive treatments based on their age reflects ageist attitudes by assuming that they may not benefit from such treatments simply because they are older. So this approach fails to consider the individual's preferences, values and potential for recovery and improvement.